Hi, everyone. Good afternoon, and we're going to go ahead and get started. Welcome to our webinar on Maryland's fracking win, a public health perspective. We're really happy that you've chosen this to join us today for this very important and I'm sure very educational conversation. My name is Prasanna Gurung. For those of you might be your first time joining a webinar with Halt the Harm, I'm really excited to be here. And I work with Halt the Harm Network, and I'm going to be moderating today's session. So really quick before we get started, I'm going to go through some quick housekeeping guidelines for today before we dig into the presentation. So first point, fear not, this webinar will be recorded and emailed to all registrants and attendees. So if you feel like you need to jump off before the end of the webinar, you just don't want to figure out what you missed out, or you want to share this with other folks who weren't able to join, we will have that ready for you definitely by the end of today, if not tomorrow. Second point, if you're experiencing any technical difficulties, and if you're joining in by computer, you can chat Katrina Ledbetter, who's my colleague, in the chat box in the bottom part of this control panel. It should be on the right side of your screen if you're joining in by computer. If you're not joining by computer, or if that's not working for you, you can also just email us at info@halttheharm.net, and she will get back to you as soon as she can. She's helping out in the back end, so thanks, Katrina. And you can just ask her with any questions and your contact info during the webinar, and we'll just have someone or have her get in touch with you to help you troubleshoot. And then last but not least, we do have a really short survey at the end of the webinar to just get any feedback that you might have. And we want to make sure to share it with our team and the panelists as well, because as some of you may know, this is always a work in progress, and we want to make sure our webinars get better and better. So just a little bit about how today's webinar is going to work. We're going to start off with presentations from our panelists today. They'll present for about 30 to 40 minutes, and we want to leave enough time for Q&A for sure at the end of discussions, so you can engage. So again, to ask the moderators a question, or if you're having technical difficulties, you can use the question chat box as seen here to send a message to us. And we'll be answering questions, or excuse me, we'll be collecting questions throughout the course of the webinar. And so we'll be, if you're seeing something on the presentation and it strikes you, you don't need to wait until the end. You can just chat us the question, and we'll be keeping a queue of all the questions and bring them up at the end. So now that we have that out of the way, here are today's speakers. We're super lucky to have three really great panelists today. We have Tim Whitehouse, Gina Angiola, and Ann Bristow. Tim Whitehouse is an executive director of Chesapeake Physicians for Social Responsibility. He has more than 20 years of experience working with a wide range of environmental issues with governments, businesses, nonprofit organizations, and community groups. He is interested in the interface of policy and science and on strengthening transparency in government. Next, we have Dr. Gina Angiola. She's a retired physician who's passionately committed to preventing illness by promoting healthy environments. She believes the work of physicians now more than ever cannot be limited to the office setting or the operating room. She was the lead campaigner for Chesapeake Physicians for Social Responsibility on the issue of unconventional gas development in Maryland. She co-founded Concerned Health Professionals of Maryland and served on the steering committee of the Don't Frack Maryland Coalition, which led the powerful grassroots movement for the legislative ban on fracking, which passed in 2017. In addition, she supports Chesapeake PSR's work on energy efficiency and clean energy solutions, as well as emerging work on soil health and regenerative agriculture, all of which are vital to addressing the most urgent public health issue of our time, climate change. Dr. Angiola has a BS in chemistry from MIT and a medical degree from University of California, Irvine. And last but not least, we have Dr. Ann Bristow. She's a retired professor of psychology from Frostburg State University. She has been a health volunteer and advocate at high school and has worked with public health departments providing science-based educational programs, consulting in clinical services, and supervising graduate interns. She developed and taught health psychology courses at FSU and chaired the AIDS Alliance of Allegheny County for many years. She's committed to utilizing the latest research, health research, to help the general public and practitioners participate in policy decisions and engage in evidence-based practices. So thanks all to the speakers. Really quick before we get into our speakers today, just want to talk a little bit about Halt the Harm for those of you who may not know. Halt the Harm is a national advocacy network designed to connect, serve, and support the dedicated individuals and leaders like yourself working to halt the harms caused by fracking. The network's goal is really to expand and strengthen the base of leaders and supporters in the movement, to connect them to one another, and to facilitate collaboration by developing services to equip leaders with the tools and strategies they need to halt the harms of fracking, whether it's in their local community and or on a larger level, and ultimately to win the fight nationally. Since its start almost 4 years ago, the network has grown to more than 500 leaders and 12,000 supporters across all 50 states. So who are the leaders of Halt the Harm, or who is in the network? So leaders in the network are individuals actively working, collaborating to help those living in communities negatively impacted by fracking, working on fracking. So I'd assume everyone on this call is a leader. A leader can be really anyone, whether you're a concerned parent who's organizing other parents at their school against local drilling, or you're a career organizer working for a larger group, or a medical professional. Leaders are able to access free resources to the network and services online. Many of them are listed here, like our leader directory, for example, where you can email others directly or follow up with them on social media and find other folks working in fracking in your area. Another service being campaign strategy, helping folks brainstorm campaigns or helping them promote ones that are existing, webinars like this one, and event support, just to name a few. So here I just have a snapshot of a campaign that we did last year called Raising Resistance, really highlighting industry intimidation against folks working on fracking, which was a really interesting campaign to be a part of, and just giving you a snapshot of some stuff that we've worked on. So some of you listening today may already be a leader, but if you are not one yet, you are in luck. You should look out for an email from me in the next couple of weeks or so, giving you access to these resources online. And I'm happy to talk to you personally about any questions you might have, and just to get to know you and learn about your work. And we're also opening up open hours, kind of office hours online, a virtual kind of check-in chat space in a couple of weeks. So look out for that from us. I'm really excited about that. So now I'm going to go ahead and hand it over to the presentation to get that started. So I'll hand it over to Tim to start the presentation section of the webinar.
Great, thank you. My name is Tim Whitehouse, and you can go to the next slide. There you go. My name is Tim Whitehouse. What I'll do is offer a brief introduction to the issues and talk about the need for all health advocates to challenge industry secrecy and misrepresentation, whether you're advocating for tighter regulations, a moratorium, or a ban. This was a key component of all of our work in the state of Maryland. Dr. Ann Bristow will talk about how a health science voice was used to lay the foundation for a moratorium and then a ban in Maryland. And Dr. Gina Angiola will speak about how health professionals and health advocates organized to keep fracking out of the state. If you have slides in front of you, you can see that many of the documents and articles referenced in these presentations can be found at the website on the slide, which is, for those of you on the phone, www.chesapeakepsr.org/education. Next. As we begin this webinar, it's important to remember that in the last 5 or 6 years, times have changed. Gone are the days when oil and gas executives could stand in a conference center and make a toast to fracking using clear, clean frack fluids, those are their words, as a way to dismiss and belittle the health concerns of those caused by fracking, of those harmed by fracking. Next slide. So a take-home message here is health professionals and health advocates now have enough experience and knowledge to organize and effectively advocate for an end to fracking. To do this, in our collective opinion, they must insist that health professionals and health advocates be given a place at the table, but this is important that they not let the process compromise the individual. Second, challenge efforts by the industry and policymakers to hide important information from the public and misrepresent the science. Third is amplify the voices of clinicians, researchers, and other health professionals who are concerned about the potential health effects of unconventional natural gas development and production. Fourth is educate the public and policymakers on the latest research on the health and environmental impacts of fracking and fracking-related activities and infrastructure. And finally, advocate for bans or moratoriums because no regulatory approach can adequately protect public health and the environment. Or if there's already widespread fracking in your area, for tightening of existing regulations while processes are developed for a rapid phase out. Next slide. So how did the process unfold? In Maryland, the political leadership developed a plan to allow fracking to occur in the state. The first, this was not hidden from the public view, by the way. It was spelled out in writing and in pronouncements of the political leadership of the state. That plan, which was just laid out before you, was to create a commission to do studies or study without health input or health impacts closely examined, and then to allow safe fracking through regulations. However, this is what actually happened. Dr. Ann Bristow, who was a commission member, will explain more about the commission process and how health advocates insisted that the state take health issues seriously. So, because of advocacy of people and organizations within Maryland, such as Chesapeake PSR and the Maryland Environmental Health Network, these groups put pressure on the state to take health concerns more seriously than they had been previously taken. And as a result, health impacts were considered and a health study was done. Next slide. So one observation from this process is that environmental and health advocates must do a better job at challenging industry secrecy and misinformation. Secrecy and misinformation are the lifeblood of the industry. It allows them to say there's not enough data to prove that fracking is harmful, while they are the ones that are either hiding the information or making sure data is never collected. As a consequence, here are 3 things health advocates did in Maryland. We developed a right-to-know plan, we worked with medical and health organizations, and we challenged industry misstatements. Next slide. In Maryland, we created a right-to-know plan, although we did not call it that at the time. This effort operated separate and apart from the main fracking coalition because it was designed to educate legislators about industry tactics and to help organize health professionals and health advocates who might be reluctant to get involved in a ban movement, but who were concerned about the industry's tactics and behaviors. Several different groups were involved in each aspect of this plan, both health and environmental. These include Clean Water Action, Earthworks, and the Maryland Environmental Health Network. Medical societies and organizations do not partner with environmental or health advocacy groups, but they supported similar legislative efforts. For 3 years, several legislators who were doctors introduced legislation pertaining to the first 3 bullets on the slide. Those were to require drilling companies to provide comprehensive data to the Department of Health. These included toxicological profiles and epidemiological evaluation, chemicals and agents. It also included requiring drilling operators to report the chemicals they use to a publicly accessible online database managed by the state and paid for by permitting fees. And third was to set up a process that would allow Maryland health professionals to expeditiously obtain and share information needed to treat patients and report public health concerns. This legislation did not get out of committee and was strongly opposed by the oil and gas industry, the Farm Bureau, and the chemical industry. But it was an invaluable instrument in educating legislators, health associations, and health advocates about industry tactics. The last 2 bullets were separate and apart from these first 3 bullets in that they were organized by health advocates and health organizations. That was to prohibit the use of non-disclosure agreements between drillers and local residents, and to ensure that chemicals and other agents injected into the ground are not subject to restrictions on trade secret rules. Next slide. So what you see on your slide now is part of a petition that Chesapeake Physicians for Social Responsibility launched very early in our organizing effort with the Alliance of Nurses for Healthy Environments, Maryland Clean Water Action, and Earthworks, and Halt the Harm. Almost 10,000 signatures were received. This petition explains how industry claims that there's no proof that fracking harms human health, but they use non-disclosure agreements to keep people quiet about the harms they have suffered from fracking. It asked the Maryland Petroleum Institute and Americans Natural Gas Alliance to ask their members to allow those who have signed non-disclosure agreements to speak publicly about the harms fracking has caused them. This petition is on our website and also on change.org if you Google the title of the petition. Over 5,000 people signed, almost 10,000 people signed it, and over 5,000 people who signed the petition opted in to receive regular updates on the fracking campaign in Maryland. This indicated to us that there was a huge issue in this issue, and that it was of great concern to people in Maryland, whether they were for fracking, against fracking, or uncertain. Next slide. Here's a handout we did at many meetings, again, targeting people who were concerned about industry behavior, but who may have been uncertain about whether they supported fracking, were against fracking, or whether it should happen in the state and under what conditions. It's used to back please. It's used to describe non-disclosure agreements and how they work. And we used it to point out that behind every non-disclosure agreement is a person or family who has been harmed. And wouldn't it be great if they could talk? We not only talked about the process of a non-disclosure agreement, but industry denial, the expense that families have to go through to enter a non-disclosure agreement, the stress they have to go through, and how eventually oftentimes there is a settlement, but once that settlement is reached, they cannot talk about fracking or the harms that fracking caused them. Next slide. Trade secrets are also a huge issue, and in our opinion, no company should have the right to use trade secrets to withhold information about chemical mixtures or formulas they are injecting into the environment. The public right to know, we believe, outweighs the commercial interests of the oil and gas industry. This is something we continually spoke about at meetings throughout the state and before state legislators. Trade secrets require the signing of non-disclosure agreements by those receiving that information. It allows information to be withheld from health researchers and puts restrictions on what medical professionals can talk about to the public. I'd like to emphasize, too, that these issues revolve not only around chemical names, but their mixtures and formulas. The State Medical Society in Maryland got involved in this issue because they opposed efforts by the state in their draft regulations and by the oil and gas industry to require health professionals to sign non-disclosure agreements, often referred to in the press as a medical gag rule. This is a huge issue in Pennsylvania also, where the Supreme Court ruled that the state's fracking medical gag rule was unconstitutional. The emerging science and the industry efforts to suppress information and their support for gagging the medical and health communities were reasons, in my opinion, why the State Medical Society in Maryland and why the Maryland chapter of the American Academy of Pediatrics eventually supported a ban on fracking in the state. Next slide. The environmental and health communities did an excellent job of challenging industry misrepresentations at every step in the process. This letter to the editor in the largest newspaper in Western Maryland, I have an excerpt here, followed a common industry refrain that the United States Environmental Protection Agency gave fracking a clean bill of health in a study, and US EPA found that there was, quote, no widespread systematic drinking water contamination caused by fracking. Next slide. Here's our response written by a member of our advisory board. Number one, the EPA report notes that its findings were limited by insufficient pre- and post-fracturing data on the quality of drinking water. Number two, the fracking industry itself is responsible for this lack of data. The industry fights against requirements that they monitor for water quality. It refused to share information with US EPA for the study, and it requires people to sign non-disclosure agreements. And number three, in this letter and in our communications, we always say if the writer of the letter that misrepresented EPA's study really cared about water quality, he, in this case, or she, would urge the industry to operate in a more transparent manner, allow those who have been harmed by fracking to speak publicly about the harms they have suffered, and finally urge the industry to fund robust water quality monitoring programs. Next slide. The concluding remarks that I will offer on secrecy and transparency before handing it over to Dr. Bristow is that people really do care about facts. They are rightfully suspicious about industry and government secrets. The absence of data and information does not mean something is safe. And finally, industry is responsible for the absence of data and information. Thank you, Dr. Bristow.
Hi, just really quick, this is Bryce, and I just wanted to interject, and thanks, Tim, for that. I just want to remind folks to ask questions if they're coming up. Make sure to ask them in the chat box to the bottom right of your screen, and you can also raise your hand. There's a couple different ways to ask questions, but go ahead and do that as the presentation is going. So go ahead, Anne. Sorry about that.
Thank you. This is an overview.
There, I think we lost Anne. Let's see here.
Can you hear me now?
Yeah, we can hear you now. Perfect.
Okay. Well, did you hear any of it?
No, we can hear you now, so go ahead.
This is an overview of Maryland's path to the ban. I'd like to acknowledge that a core group of Western Marylanders worked 7 more years fighting fracking, coming to their communities. I will speak to how health professional voices and the insistence that relevant research be addressed played out over the 4 years of Governor O'Malley's Marcellus Shale Advisory Commission on which I served. The governor's 2011 executive order tasked commissioners with assisting state policymakers in determining whether and how gas production from the Marcellus could be undertaken without harming public health and the environment. But the commission never dealt with whether, only how, and no public health professional was initially appointed as a commissioner. The executive order also instructed the advisory commission to take advantage of ongoing research. And early in our work, case studies and animal research indicated harms and the need for further health studies. As concerns about public health mounted, health professionals in their focus on prevention of harm increasingly asked whether production could be undertaken without health harms. The how, which was writing regulations based on industry best management practices, seemed premature to us given the emerging science. Health advocates were instrumental in adding a health study and a public health appointee to the commission. Findings from this study, the public health voice in the New York State ban, and a rapid increase in research documenting harms were instrumental for health advocates working for the moratorium and then the ban in Maryland. Next. Concurrently, New York was studying fracking, and health groups nationally were calling for health impact assessments of fracking in states with recoverable shale gas. Next. Public awareness of risks from fracking significantly increased over the 4 years of the Commission's work. Most meetings were held in Western Maryland where shale would be developed. Although appropriate, this isolated the Commission and reinforced the idea that fracking was only a Western Maryland issue. However, attendance increased and citizens became more outspoken and requested and received more time to make public comments. In the final months of the Commission, a police presence was ordered by the administering agencies, the Departments of Health and Natural Resources. Also, the public participated in scoping for Maryland's health study, which began in fall of 2013. Next. The health study in Maryland utilized fracking, health, and environmental research from states where unconventional natural gas drilling was already occurring. Maryland owes much to the citizens of other states, particularly our neighbors in West Virginia and Pennsylvania, who have served unwittingly and in many cases against their will as research subjects for the studies that informed Maryland's policy decision. Although the general public and public health advocates insisted that the state conduct a health study to inform policy, this study was largely ignored by policymakers and the Commission. A Maryland Department of the Environment risk assessment and draft final report were completed before the health study was even published. The recommendations of the Department of Environment's final report for the Commission were based on best management practices that had been summarized in a 2013 report that referenced only 2 health studies from 2012. Finally, almost all recommendations in the health study were ignored. So some commissioners felt co-opted by this process, as well as many others, that we were being used to give a stamp of legitimacy to a flawed process. To counteract the concerns about our health voices being compromised, we focused on health education beyond the Commission, as well as continued advocacy to the Commission. Next. The government-funded study that produced this graphic from the University of Maryland is a powerful tool for public education, but it took health advocates to bring it into the public eye. And though downplayed on the Commission, the best practices regulations written by the Department of the Environment could not eliminate the 8 hazards highlighted by the state's own health study. It became increasingly clear to health professionals and the general public that no regulatory regime could protect human health and keep us safe. Remember that less than half of all the health research findings that have now been published were available when Maryland released their health study. Using this chart throughout the moratorium and ban campaigns, we took the opportunity to explain how these likelihood of negative public health impacts might be updated given the more recent research. We continue to address what is not in this graphic: soil health and other impacts on agriculture, health harms to animals, pets, livestock, wildlife, and the public health harms associated with accelerated climate disruption. Next. A team of health professionals and health advocates represented on this slide read and critically evaluated the research literature, often reaching out to researchers themselves for clarification and information about research in progress, writing research summaries, developing handouts and slide presentations, attending conferences, and preparing for commission meetings. The PSR and Concerned Health Professionals New York Compendium and PSE reports and graphics were frequently used. In addition to general public presentations, we also focused on bringing the science to local policymakers. This resulted in our presentations being placed on institutional and governmental websites to which the general public could refer. And we went everywhere: churches, local conferences and festivals, local business and professional meetings. We tabled at farmers markets and environmental events. Advocates focusing on business, economics, and recreational tourism didn't necessarily understand how public health was connected to their issue, so we focused on making these connections. These are some of the presentations given in Western Maryland, and similar presentations were made by allied health professionals throughout the state during our campaigns. Next, we were very careful in our use of terminology, as this is foundational to understanding the health research literature. When industry says that certain harmful effects are not caused by fracking, they are often accurate. But fracking to the general public means much more than creating fissures in rock through explosive forces, which is high-volume hydraulic fracturing. Health harms are associated with the entire life cycle of natural gas development and production, and it can be difficult to separate out which parts of this industrial practice are associated with which harms. Many occur simultaneously or continuously over time and are likely having cumulative impacts. Next. To reduce complexity of understanding these mechanisms of the life cycle exposure from fracked gas, we focused on air, water, and soil exposure pathways and the chemicals found in fracking fluids known to cause health harms. Soil health is especially important to farmers in rural Western Maryland, and food contamination is relevant to everyone. We developed a fracking and food brochure to be used at local farmers markets and farm sales. Next. There was early public awareness of possible air contamination, as people living around infrastructure across the state were already reporting effects. And early research of the health effects associated with fracking were pointing to air pollution. Next. Additionally, Western Marylanders living on top of Marcellus Shale were surrounded by gas drilling and associated infrastructure, as you can see on this map of nearby counties in West Virginia and Pennsylvania. This University of Maryland study showed increased levels of ethane in Baltimore and Washington, D.C. attributed to gas development in nearby states. Next. Water is the exposure pathway best understood by the general public, yet water contamination in Maryland's health study ranked lower than air contamination due to a lack of research on water, which Tim referred to earlier. Pennsylvania well water data were released after Maryland's health study, and I use this slide as an example of what we did not know that would have affected that health hazard rating. More recently, in the Public Herald investigation of 2017, they documented over 4,100 drinking water complaints related to oil and gas operations reported to the Pennsylvania Department of Environmental Protection, but never released to the public before then, nor referred to in the EPA water study. Regulators are underfunded and subject to pressure from industry. It's noteworthy that PA was the model used for draft regulations in Maryland. Damage to drinking water aquifers could be irreversible, and water and health were the top two reasons people gave for their concerns about fracking, as documented in several public opinion polls, which we referred to. Next. The public was also very concerned about what they were hearing of earthquakes in Ohio, which is where Maryland fracking wastewater would have been hauled by truck and injected deep underground. High-volume hydraulic fracturing and underground wastewater injection are similar practices, though pressure and fluid volume vary. Hydraulic fracturing has been associated with induced seismicity, including this very recent report from the Marcellus of northwestern Pennsylvania. Next. And another area of concern, health harms not evaluated by the Maryland Health Study, is the greater climate forcing capacity of methane. Currently, industry reports that fracking is a health-promoting activity because fracked gas has displaced coal and power plants. Industry does not mention methane as a potent greenhouse gas, nor the air toxics released with the methane. Next. Most importantly, we presented the latest research showing an association between exposure to fracking and negative health effects. These were all studies released since Maryland's health study. The Johns Hopkins University and Geisinger Health System research in Pennsylvania is well respected and was very influential with Maryland legislators and the general public. The birth outcome and asthma studies from Hopkins received much attention in the press in Maryland and nationally. Next. There are now over 900 studies on fracking, and they're summarized in this compendium, with over 80% published since Maryland's foundational report for draft regulations. It is this body of research consistently pointing to health harms that convinced the Maryland legislature. This convergence of research results gives confidence to the validity of associations observed in humans and animals exposed to fracking. This body of research findings is the work of numerous researchers at different institutions studying different populations in diverse geographic regions of our country and shale plays, and with varying methods. When these research findings converge, indicating the same or similar health and environmental harms, health professionals and health advocates speak confidently that these findings should underpin public policies. Next. Last month, and not long after Governor Hogan signed the first legislative fracking ban in the United States, industry responded to the importance of a public health understanding of fracking harms, and our frequent references to the Concerned Health Professional and PSR compendium in New York demonstrating risks and harms from fracking. They responded with cherry-picked research and other science-distorting tactics in their own compendium. I take this as a sign of the power of our public health message. Had the health voice within the Commission been co-opted, we would have had little traction in our movement to halt fracking in Maryland, which Dr. Angiola will describe next. Thank you.
Prathana, did you want me to dive in, or did you have anything you wanted to add?
Yeah, no, I think, thank you so much for that, Annie. And yeah, Gina, go ahead and just a quick reminder again to get those questions going. Thanks.
Great. Good afternoon, everyone. My name is Gina Angiola, and as mentioned, I'm a board member of Chesapeake PSR, and along with Dr. Bristow, co-founded Concerned Health Professionals of Maryland and served on the steering committee of the Don't Frack Maryland Coalition. My goal today is to share information about how we organized our advocacy efforts to win the fracking ban. You've heard a bit about the years from 2011 to 14 during the commission process, so I'll focus on the organizing activities from late 2014 to 2017. To set the stage, it's important to note that the political landscape in Maryland changed dramatically in late 2014 in two ways. First, a Republican governor was elected in Maryland, which is generally a solid blue state. This shocked the political establishment. Second, not long after Maryland's Governor O'Malley announced fracking could be done safely under tight regulations, New York's Governor Cuomo announced a ban based on health concerns. These two changes created an opening we seized upon to call for unity behind a moratorium. Next. Although we're focused in this webinar on the role of the health voice, it's important to put it in context. We were part of a much larger movement led by a coalition of groups, including health groups, environmental and community groups, and many others. These groups had not always been in alignment prior to late 2014, with some working for stronger regulations, others for short moratoria, and others for a ban. But health voices played a central role in bringing groups together around the need to buy more time for additional health studies to emerge, many of which were already in progress. We pushed for a long-term moratorium, helped unite the environmental groups and others behind that specific goal, and worked hard with this rapidly assembled coalition to get that legislation passed in 2015 in a 90-day session. As the health studies started pouring in later that year, we recognized that these findings were likely a small sampling of what we'd be seeing in coming years. These were the illnesses that developed quickly after exposures. If these were being documented, it was likely other illnesses, like cancers that can take longer to show up, would soon follow. We also knew regulations couldn't prevent these problems. Given that the moratorium legislation only delayed permits from being issued prior to October of 2017, we knew we had to now go all out for a ban. The core advocacy groups formalized the coalition structure in 2016 with a written agreement to work only on ban legislation and set to work building the broadest and most powerful coalition possible. We ended up with over 150 groups involved, including faith groups, farmers, and the NAACP in Maryland, among others. Every group brought significant strengths to the effort, but I would like to give special recognition to Food and Water Watch, which really had vision and strategic smarts and put enormous resources and expertise behind these efforts, including helping others develop their own organizing skills and capacity. Next. Also in January of 2015, as the larger Don't Frack Maryland Coalition was forming, a subset of us with health backgrounds and representing several different health organizations formed Concerned Health Professionals of Maryland. We saw a need for a visible health presence in this debate. We worked both to educate the public, legislators, and other advocates, and to mobilize people, especially health professionals, to take action. We maintained a somewhat separate voice, but were part of the bigger movement, and not only collaborated closely with allies, but also helped lead that movement. Next. This slide offers a listing of the many activities we carried out. It was a full court press. To highlight a few specifics, we started with ongoing self-education, including traveling to neighboring states to speak with people who had been directly impacted. A key tool we used for both the moratorium and the ban campaigns was a sign-on letter for health professionals. These were not typical 2 to 3 paragraph sign-on letters that you might see for outreach to other constituent groups. These were 3 to 4 page letters that explain the health risks in detail, fully referenced with footnotes. The goal was to educate the health folks signing the letter and the legislators who are our targets, while also collecting names of health professionals who showed interest in the topic. Additionally, we wrote op-eds that helped define the fracking issue as a public health issue, and we provided detailed written and verbal testimony on the inadequacy of proposed regulations and the vital importance of the proposed legislation to keep fracking from beginning. In short, we participated in every activity we could to amplify the health messages, and our coalition allies used their large networks to amplify our voices to help move public opinion. Some folks say legislators don't really care about the science or the health risks, and some of that is true, but their constituents do care. The key was to reach them and have them demand their legislators support our bills. Next slide. We scientists and health professionals often try to generously share everything we know, but that can actually be counterproductive. We quickly learned that we were most effective when we focused on a few key messages as outlined in this slide. The next few slides illustrate each of these individually. Next. As Dr. Bristow mentioned, when we're using the term fracking in a health context, it's often shorthand for the entire life cycle of unconventional gas development and production. From the mining of the sand that causes silicosis and lung cancer, to diesel pollution from trucks, to air emissions, noise pollution, and potential water contamination from the drilling and hydraulic fracturing activities, to the hazardous air pollutants from compressor stations that run 24/7. All of it matters. And the best way to stop it all is to stop the extractive process in the first place. Next slide. While proponents of fracking tried to focus attention on only 2 counties in the western part of the state, there are actually gas basins throughout Maryland, as this map demonstrates. And while industry often tries to convince the public that most gas basins will never be developed because they're not financially profitable, we know better. Market conditions can change, especially with the exporting of fuels. We made sure to let everyone know that if they lived anywhere near a gas basin, they would be vulnerable to drilling down the line. Furthermore, ancillary infrastructure could pop up in any county, and air pollution and water pollution don't respect county boundary lines, so everyone is at risk. This powerful message was reinforced by local ban campaigns, which helped educate and mobilize citizens in almost every legislative district. Next slide. This map shows the local bans or resolutions that ultimately were passed. There were three were in Western Maryland in municipalities on top of the Marcellus Shale, which sent a clear message to lawmakers across the state that many citizens in Western Maryland did not want fracking, despite what their own state representatives were saying. Bans and resolutions were also passed in more populous counties, building enormous political pressure and getting the attention of legislators who didn't think this issue would be their problem. Their constituents made it their problem. We even managed to get support in regions that weren't near shale basins, some in Republican strongholds. Local municipalities showed solidarity with neighboring municipalities across the state. Plus, they didn't want to be hit with tax bills down the line if a major accident occurred. And everyone everywhere cared about water supplies. Next slide. This slide gives a clear visual representation of the explosion of peer-reviewed research on the impacts of unconventional gas development over time. Of the subset of studies looking at health, air, and water quality, the majority were showing risks or actual harms. Importantly, using this graph, we could show how little information was actually available during the Marcellus Shale Advisory Commission process, demonstrating why those reports were premature and misdirected policy. Next slide. From my perspective, this message that no regulations could protect became the most important of all as the ban campaign progressed. Previously, during the moratorium campaign, we had built the case that regulations being proposed, whether called gold standard or platinum, were simply inadequate. But what was gradually becoming more and more clear was that there were scientific, engineering, and other reasons why no regulations could ever be adequately protective, even if properly enforced. Again, there were many reasons for this, but we tried to focus on a few and repeat them over and over again. Any one of them independently justified a ban. Next slide. First, well leakage was inevitable, as casings and cement would fail over time. Cement cracks, chemicals erode, the earth shifts. People easily understood this. This chart from an industry publication shows leakage rates starting at 5% right off the bat and up to 50% 15 years out. No regulations can solve what industry can't fix. Furthermore, these wells were permanent conduits for leakage of chemicals into ground or air, and no one, not industry, not regulators, would be monitoring these structures over the decadal timeframes required. Next slide. Next. The constant barrage of news reports about earthquakes definitely helped our case. People were starting to understand that disposal of fracking wastes was one of the biggest problems out there, and underground storage was quickly becoming the only viable option. But it was causing a dramatic rise in earthquakes, as shown on this slide of earthquake activity in Oklahoma. Not only were studies showing earthquakes from wastewater storage, but also now from the fracking process itself. Again, no regulations could solve this. Next slide. Finally, there was climate change. Fracked gas was sold to the public as a bridge fuel to a renewable energy future. But Howarth and others blew massive holes in that argument with diagrams like this, which showed the greenhouse gas footprint of fracked gas was worse than coal or oil when both carbon dioxide and methane were considered. So any one of these messages, from health effects like asthma exacerbations and adverse birth outcomes, to potential contamination of food supplies or irreversible damage to aquifers, to the secrecy and deceptive practices of industry, to the well leakage, earthquakes, and climate damage, any one of these showed the absurdity of even contemplating allowing fracking to begin in a state that had not yet drilled a single well. For states that already have fracking, these issues provide solid reasoning for tightening regulations while developing a pathway for a rapid phase-out of this process. But facts and logic will only get you so far. The key to keeping this out of our state was to use that information to build political power. Next slide. Building political power is the only way to win. As we reflect on our campaign in Maryland, the following key takeaways emerged. First, we as health professionals set clear goals based on our understanding of the science and our commitment to the prevention of harm. We would not compromise, including with other advocates. Second, we worked to engage everyone, but with a special emphasis on reaching other health professionals because we were uniquely positioned to do so. Third, we worked closely with coalition allies. When they needed a health speaker, we showed up. When they needed a health voice in the room with a legislator, we showed up. All of this was in the service of getting constituents in every legislative district aware and activated, making phone calls to their legislators, writing letters to their local papers, and organizing in their own communities. And sometimes that political power has to be visible in the streets. Over 1,000 people showed up to a march and rally in Annapolis, complete with bagpipes, banners, and prominent speakers. It was a visual display of power that surprised everyone, legislators and organizers alike. The final and most important takeaway is that you have to believe you can win. If you don't believe it's possible, you'll compromise too early, and it will be difficult to inspire the kind of support needed. Politicians are here to serve the people. Too often they forget that, and too often we fail to remind them. Next slide. Believe you can win, and you will. Thank you for the opportunity to share our story.
Great, thank you so much, Gina. And I just wanted to bring up the link again that Tim mentioned earlier. A lot of the information that you guys heard about is going to be up on this website here. And for those of you joining by phone, it's www.chesapeakepsr.org/education. So we'll move right ahead into the Q&A and discussion portion of our webinar today. On deck, we've got a question for Tim. This is from Barbara Gottlieb. Sorry if I mispronounced your last name. The question is, you mentioned early in your presentation that health professionals should be at the table, but, quote, don't let the process compromise the individual, end quote. Can you elaborate on the pressures that may be placed on individual health professionals or other pitfalls that they should be alert to? How can engaged health professionals protect themselves from pressure and or attacks?
Thank you. I will address part of the question and then ask Dr. Briscoe to add her thoughts. So health professionals have been asked to be on panels, on commissions, on different advisory groups, either for the government or for organizations. And oftentimes those groups may have a goal, often spelled out in writing, but not always, that may be inconsistent with the science or the particular viewpoint of the health professional. And so the pressure will be on that individual to be a team player and to sign on to something that's characterized as a compromise between all groups. And that may be appropriate sometimes, but in many instances it's not appropriate to compromise. And that we witnessed that with the commission, and maybe Dr. Briscoe, you can offer some thoughts on that.
I think that it was what made us effective at responding to those attempts was to be broader than ourselves by having health allies across the state as well as allies with other groups, and particularly the general public, who became very engaged on this issue, especially in Western Maryland, but throughout the state, so that the more public we were with what was happening, I think it was at times an embarrassment for attempts to shut down the health voice. So it was keeping steady pressure of that health voice, particularly in the public eye, that I think got us through that. It's interesting, I just heard yesterday about some presentations we did in Western Maryland associated with a local college, where county commissioners and the president of the college were very concerned with what we had done, and there was a lot of a backlash, but it was hard for them to stop that once the voice was out there and citizens were asking for those kinds of presentations. So Barbara, I don't know if that gets to, you had a few pieces in your question, if that answers all of them.
Yeah, I think, thank you, Tim and Annie, for that. I think, and for everyone who's asking questions, if there's any, we're trying to get to as many questions as we can in the next couple of minutes that we have left, but if for some reason we haven't answered your questions well enough, feel free to email us afterwards, and I'm happy to share those with the panelists and get back to you. So we'll just go ahead and move on to the next question we have. It's from Ellen Barfield, and the question is, so now we need to resist fracking products, compressor stations, pipelines, export facilities like Cove Point, which is already seeing emissions before it's even completed. Cove Point needs a quantitative risk assessment, which Hogan has been pushed on, but not enough yet. And it's a little unclear for me as to what the question is. So Ellen, I'm just going to go ahead and mute you if you want to ask the question yourself or clarify.
Sure. What can the health professionals do to help push this?
Great. So I guess the question's for either folks, Tim and or Gina.
Well, Ellen, this is Gina. I was actually involved in the Cove Point battle before I got as deeply involved in fracking as I did. I think each of us has to figure out where we can have the most impact. And at that particular point in time, stopping fracking in Maryland seemed like the best place for me to put my efforts. But I think we do have to continue now to fight the rest of the infrastructure. And I think that the fracking ban has actually helped create the framework to do that. So I think people working on infrastructure helped with the ban effort. People working on the ban are helping with all the other infrastructure efforts. And, you know, it's all part of one big problem. The bottom line is we have to move away from fossil fuels, period. I mean, that's the long-term goal here.
Great. Thanks, Gina. Tim or Ann, did you guys want to address that, or should we move on to the next question?
I'll just add, this is Annie, that it's the same research. And so it's the same strategies. It's the same kinds of arguments that need to be made. It's the same people that we need to mobilize. So there's the current campaign to contact Governor Hogan, and we need to get more health professional voices in that campaign.
Great, thank you.
Can I just add, admittedly, the political,
yeah, sure.
the strategies and political dynamic of that fight are different because the regulations happen at different levels, and the decisions are made at different levels. So, you know, there has to be a separate strategy for that.
Great. So the next question we have is from Dylan Weiss. And the question is, what is your response to industry saying that they're being quote-unquote green by repurposing the wastewater to help salt roads in the winter and irrigate crops in agricultural areas suffering from drought?
Tim, you want to take that?
Anybody else want to jump in on that one?
Very quickly, there have been enough studies done to know that the water that comes back out from deep within the earth is extremely dangerous. And I know US EPA has prohibited that from being put into waste treatment plants. And again, there's a lack of, oftentimes a lack of data and a lack of testing, and that's the way industry wants it.
It's a really bad idea. They shouldn't be allowed to do that.
Great. And the same Dylan who that asked the question had an additional comment. They said, several years ago I had high levels of barium in my blood. I had several bouts of pneumonia, and granulomas in my lung were identified. A soil sample was done in a dump next to me where development and high levels of arsenic were found. When the dump was paved over, my coughing totally was resolved. I live about 10 miles from actual fracking. So yeah, thank you, Dylan, for sharing that with us. The next question we have here is from Laura Wenzel. And the question is, what's a good way to motivate health professionals who aren't involved now to get involved?
So this is Gina. I will speak to that because I have to acknowledge this is a very difficult situation for health people who are actively practicing to be involved in. This became a full-time job for many of us. So I think what you need are a few people who can really devote a huge amount of energy to it that can also then pull in some of the people at key times to write an op-ed or to make a phone call or to, you know, speak to a legislator, because there were many times I'd ask my professional colleagues to just speak up at a key moment, and they did. And that was very powerful. So I think it's a little, I know it can be frustrating because it's hard to get a lot of health people involved in a continuous fashion, but just having them out there aware of the issue and willing to step up at key times is, I think, the goal that we really need. And a broader base. You're not going to get all health professionals to put this at the top of their agenda, but if you can get a core group of them, that's worth fighting for.
Tim and Ann, do you have anything to add to that? I think that's going to be our last question for today.
I would just add, if they're reluctant to get involved because they are concerned about the issue, the first part of the presentation, which is what I talked about, the secrecy and the misinformation, was a wonderful organizing tool. People get that, whether they're for or against fracking,
Right.
that we should not allow the industry to operate in this manner of secrecy.
Great. Thank you so much. So thank you, everyone, for those really great questions. Unfortunately, that's all we're at time. If you did have any questions that didn't get answered, please make sure to include it in the comment section of the survey, which you will get in once you exit out of this webinar. So please make sure to give us your honest feedback so we can make sure to keep improving these webinars. If you're joining via phone or your internet speed didn't allow you to view the slides, the videos shown on today or the recorded webinar is going to be sent, and we're going to share that with everyone who registered as well as attended. And again, if you have suggestions for the next webinar, we do these on a pretty regular basis. Just go ahead and send them my way. I'm at info@halttheharm.net, and I actually check that email, so it won't be going to a robot. It'll actually be going to me. And again, last but not least, if you want to learn more, you can check us out at halttheharm.net. Check out Chesapeake Physicians with Social Responsibility, ChesapeakePSR.org, and CHPMD.org. So thank you all so much. I just want to thank our leaders, Tim, Gina, and Annie today for sharing with us the work that they're doing. And thank you as participants for taking the time to join us and participate. So thanks all.
See if people are going to talk.